Jim Gottstein is president and co-founder of the Law Project for Psychiatric Rights in Alaska, whose mission is to mount a campaign against forced psychiatric drugging and electroshock treatment in the U.S., with an emphasis on the rapid rise in forced drugging of children. His winning the Alaska Supreme Court case against the Alaska Psychiatric Institute was a landmark ruling, and he was responsible for the release of the Zyprexa papers that resulted in a call for congressional investigation led to Zyprexa's maker Eli Lilly pleading guilty and paying $1.4 billion in civil and criminal fines. Nice to have you with us today, Jim.
Thank you, Gary. I'm pleased to be with you.
We're beginning an entire year of discussions, short discussions, but ongoing discussions of why our rights are being taken away to be able to control our own lives, where our behavior, that of our children, shouldn't be pathologized, diagnosed as a disease, and then under certain circumstances, like teen screen, where our children could actually be forcibly taken away from us, put into a mental institution, forcibly drugged, given electroconvulsive therapy, and we as parents would have no right, all because, in one case, real case, a kid wrote on a teen screen that they liked to keep a clean bedroom and didn't like parties, and they considered that's too psychiatric diagnosis. They had a compulsive disorder because they liked to keep a clean house, and they had shyness disorder because they didn't like the loud parties. People don't think it can happen. It is happening. Take us on this journey, and today we're only going to focus upon teen screen and how we, you, myself, and this audience, have to stop believing and challenge that our kids are brain chemical imbalanced, have all these illnesses. These are legitimate diagnoses and legitimate drugs, which they're not. The forum is yours.
Well, thank you, Gary. We know that the teen screen really is a drugging dragnet, and you're talking about people's rights being taken away and all that. And I think what's really happening is that everything is driven by money these days, and there's just a lot of money to be made on drugging children and youth. And one of the things that I really want to point out is that most of the psychiatric drugging of children and youth is done to poor children on Medicaid. And Congress actually prohibited payments, reimbursement for off-label prescriptions that don't have scientific support. And the Centers for Medicare and Medicaid Services, which run that program, CMS, have failed to enforce that restriction, and there's actually some funny business going on with that I probably don't have time to go in to. And children on Medicaid are 4 times more likely to be prescribed neuroleptics, which are misnomered antipsychotics. They really have very little antipsychotic properties for most. The most horrific ones, like Risperdal especially, was promoted in the use of children through the fraudulent research of Joseph Biederman at Harvard Medical School. So, and then there is a recent report from the Government Accountability Office, GAO, that foster children are 9 to 13 times more likely to be given these drugs than children and youth on Medicaid, which already are 4 times more likely to be given these drugs. And I've been working with this group in Alaska called Facing Foster Care in Alaska, and I've gone to some of their retreats, and about 90% of them have been given psychiatric drugs. The GAO report doesn't document it that high, but that's what this group of people report, and these are really the best ones. But one of the things that's really important is that Senator Carper from Delaware, he's the one who called for the GAO report, is investigating this, and we wrote a briefing paper and gave it to our Senator Begich, who's on that subcommittee, and it's on our website, psychrights.org, to really push the government to enforce this restriction to what's called a medically accepted indication. And so that's one thing. And the other is that we have established an initiative for people to really take direct action through what's called the False Claims Act, or whistleblower lawsuits, also known as key town lawsuits. And it's a special, unique federal statute that allows anybody to sue for fraud on behalf of the federal government. And our idea, what's happened, you mentioned Eli Lilly paying $1.4 billion, of which I got none, and I got saddled with about $300,000 in legal bills, of which I still owe a bunch. Pfizer paid $2.3 billion. AstraZeneca, I think, paid $750 million, and on and on. But these drug companies, these giant or seemingly giant drug company settlements are not really solving the problem, because it's just a cost of doing business to them.
Jim, let's go for that for one more moment here. And for any station that has to say goodbye in another minute and a half, you can continue listening to the rest of this interview on my internet radio program. By the way, yesterday's original commentary on Gardasil, that I'm absolutely opposed to based upon it having no science that it's doing anything good and a lot of damage, that went on for an additional 17 minutes. So if you missed that, you can go and download it. Here's part of the problem. The problem is that throughout all of human history, as people are growing up, they go through different adjustments. And these adjustments mean one day they may be happy, another day sad. They may speak out or may be shy. These are not and should never have been listed as psychiatric conditions. And there's no science whatsoever to back them up. And in fact, as you will see, and everyone will see this May, when we're going to be, I'll be down helping to lead a demonstration in Philadelphia, May 5th, to boycott the American Psychiatric Association, and they're a big meeting. There is undercover film of 12 psychiatrists, all board certified, all of them being given a completely healthy, normal person, all diagnosing this person with different mental conditions and giving them different prescriptions. Then when later confronted, they were completely non-moved by it. And then asking people attending American Psychiatric Association meeting outside, is there a brain chemical imbalance? We can't prove any. Can you actually show me proof of a brain chemical imbalance and for schizophrenia or bipolar? No, we can't. I mean, across the board. So how in the world do all these psychiatrists, mental health officials, get away with saying your kid has this and therefore we should give these medications, and you're not a good parent if you don't give them the medications, or we may turn child services on you and take your kid away if you don't give these medications, when there is zero science behind anything currently being engaged in the pharmaceutical approach to mental health?
Well, I think that there are really two things that are important to think about. One is that, as you said, children go through these different phases and may act out at different times, but basically when they become problems for the adults in their lives, when they become a pain in the neck, then basically they get targeted for these drugs, because what the drugs do is basically sedate them and just make them so that they're not so troublesome. And I really want to focus on foster children, or talk a little bit about what's happening with foster children and youth, is because if you think about it, as a legal matter, a child or youth gets put into foster care because they've been found to have been the subject of abuse or neglect. Okay, so that's going to make someone upset, a child or youth upset. Whatever's going on at home that would cause that. And no matter what is going on at home, getting yanked out of their home is going to make that child or youth upset. And then these foster placements oftentimes are really horrific. People get assaulted, they get raped, and then there's a sense of not really belonging. That lots of them have multiple placements. And I went to this Facing Foster Care in Alaska meeting once, and some of them had over 20 placements. And so there's this idea that nobody cares for them. And so what you have is all kinds of reasons why these children and youth will have emotional difficulties, and that manifests itself in behaviors that adults don't like. And so what we should be doing is helping these children become successful. And instead what we do is we say there's something wrong with your brain, which is total poppycock.
But Jim, put yourself in the position of a pharmaceutical industry. You're very smart. You're very rich. You have unlimited accesses through your holding companies and your boards of directors to banks, because one of the things pharmaceutical companies frequently have on their board of directors are heads of banking institutions. Look at Goldman Sachs. Look at these people. Why? Because they can say, we need this amount of money to pay this lawsuit. And they say, okay, that's only 4 months worth of profit. So they pay $1 billion. Everybody says, good. Now okay, that's all behind you. Nobody asked the moral and ethical question, well, what brought you to that place to make those decisions? It wasn't one person. It was a whole bunch of people who decided we've got a bad, dangerous product, but it's very profitable. It only costs us about 23 cents for a 30-day supply. We can sell it through Medicare or Medicaid, or in the state hospital, which is Medicaid, for $220 a bottle. And because we paid the lobbyist to hustle Congress and the House, they passed a law that didn't allow them to negotiate a cheaper price. So we really benefited to about $1 trillion over a 10-year period. $1 trillion. So if you put $30 million into lobbyists' pockets, who then put that $30 million into politicians' pockets, or guarantee them jobs when they leave Congress, which many did immediately after that bill was passed. They left, went to work for a pharmaceutical company, one for $2 million a year. That's just good business, isn't it? So, now, hold on, I'm not quite finished. So now they're willing to say we can buy legislators, we can buy scientists, we can buy ghostwriters to put articles in peer-reviewed literature. The FDA is not going to challenge us. We own them. The U.S. Department of Health and Human Services is not going to challenge us. We own them. The White House won't dare. We've been in there many times. We have everyone on our board, including former policymakers, these institutions, and former politicians. So we own the game. Now, the only thing we don't own yet is we haven't convinced everyone in America that they're crazy or that their kids are crazy. That's not hard to do, because look at all the garbage they watch, look at the stupid things they buy that they feel they need, including pet rocks. So if someone's stupid enough to buy a pet rock, surely we can convince them that the acting out of their daughter is a brain chemical imbalance, because that makes us money. Now, that's how the game has worked, or if you don't believe that's how it's worked, then challenge me on my statement.
Oh, I wish it wasn't the way that it worked. You're absolutely right, and it's so important that you're shining the public light on this, because I think it's the only way that anything can be done. The immorality involved is just astounding, that the drug companies would deliberately target poor, disadvantaged children to give them drugs that not only will more likely cause them to experience symptoms diagnosed as mental illness and become disabled for life, but also these drugs are causing, in adults in the public mental health system are now dying 25 years earlier on average than the general population. And there we have no idea what the effect is going to be.
But you see, therein is the rub. Jim, the biggest mistake that we could have made in all our discussion is why, if they're dying 25 years earlier when they're an adult, why didn't we mandate that every politician have to take these drugs? That would be a natural way of creating term limits. We're out of time, Jim.
Well, I think the doctors prescribing these drugs should be required to take them, frankly.
I think that every doctor I think every psychiatrist in regular practice should be required to take electroconvulsive therapy every weekend for life. Jim, you're doing a lot of good work up there. We just wanted to open the door to this discussion today. Psychrights.org. Psych, P-Y-S-C-H, rights, R-I-G-H-T-S.org. Jim Gottstein, Gottstein, the Doctor of Jurisprudence, is my guest. Jim, we're going to have additional conversations, but you cause Zyprexa to have maker Eli Lilly to cough up $1.4 billion in civil and criminal fines. So you showed one person can make a difference. We're going to ask everyone in this audience, make a difference. Say no to psychiatry. There are psych drugs for you and your children. All the best to you, Jim.
Thank you, Gary. You too.
I'm Gary Null. Thank you all for listening. Look forward to sharing more tomorrow. Have a nice day.